My Model for Improvement project was created in order to reduce the occurrence of patient falls in a hospitalized setting. Patient falls are not only a problem for my practice, but are a problem among many institutions. Although strategies have been put in place to reduce and prevent falls, they continue to be a major safety concern in healthcare. Along with being a safety concern, they are also a financial burden to healthcare institutions who are not reimbursed for these occurrences. Curry found that each year between 700,000 and 1 million persons fall in the United States in the hospitals. Research has suggested that patient falls happen due to environmental hazards as well as patients ambulating, either to void or while attempting to obtain an object in another area of their room. These findings led me to implement purposeful rounding on my unit in order to decrease the occurrence of patient falls. In order to run a successful change project, I needed to develop a project team to work with me to develop change and to participate in the PDSA cycles. My Model for Improvement project took place at Buffalo General Medical Center on 13th South, which is a telemetry medical surgical unit. The members that took part in the PDSA cycles were my nursing manager, my nursing supervisor, the day shift nurses, night shift nurses, day shift PCAs, night shift PCAs. The nursing manager and nursing supervisor took part in developing the PDSA cycle used as well as reviewing quality indicators on my unit. The nurses on both the day and night shift took place in the PDSA cycles while forming a council that discussed the improvement project on a weekly basis. The PCAs were also involved in implementing the PDSA cycle. The project aim that I developed is to reduce patient falls on 13 South, which is a 30-bed telemetry unit, through implementation of hourly rounding by the end of this project. My concept for change began with research that hourly rounding has been proven to be successful in reducing patient falls, where leadership and frontline staff were actively involved in program design. I also found research that purposeful rounding has also been proven to be successful in decreasing patient falls. Purposeful rounding includes asking patients if they need assistance, such as walking to the bathroom or having a drink of water, instead of just a visual check. The changes for my project were to develop a schedule for hourly rounding, developing a list of tasks to be performed during hourly rounding, and involving staff and leadership in the hourly rounding process. The measures I used for my project were to compare the number of falls at the beginning of the project to the number of falls following the change project implementation, and to compare the frequency of purposeful hourly rounding compared to the frequency of falls. After developing my project aim, deciding on the changes I would like to make along with the measures, I began to implement a PDSA cycle. For the plan, I will educate the staff on purposeful rounding along with what tasks to complete during the hourly rounds. I will analyze the number of patient falls through daily documentation for each shift, along with documentation of whether hourly rounding was completed successfully on each shift. Under due, I will implement hourly rounding through both PCAs and RNs on both the day and night shifts by using a checklist that keeps track of the time of rounds, along with what to offer patients during these rounds. Following the implementation, we will completely analyze the number of patient falls along with how successful hourly rounding was. We will reflect on what made this change either successful or unsuccessful and discuss the outcome of the project with the involved staff. Lastly, for acting, we will determine what adjustments should be made if the implemented changes were unsuccessful. If changes were successful, we will decide on what measures can be taken in order for these changes to be permanent. The PDSA cycle was run from weeks 5 to 13, which is a total of 8 weeks. In Figure 1, we can see the number of patient falls, and in Figure 2, we can see the number of shifts compliant with hourly rounding. The results showed that the number of patient falls decreased throughout the implementation of the project. There were 3 turning points that continued to decrease falls. The first was implementation of hourly rounding, which began in week 5. We educated the staff on why falls occur and how they can be prevented, which was in week 10. And in week 12, we changed hourly rounding to 2-hour rounding just for the night shift. The adherence to hourly rounding increased as the staff became more involved and educated on how to properly implement rounding and what leads to patient falls. When comparing the graphs, it is also shown that increased compliance with hourly rounding led to a decrease in patient falls. Since the results did show that purposeful hourly rounding does reduce falls, we would want to spread the change to other units. Spreading the change involves implementing what we have done on 13 South and moving it to other nursing units. Leadership from staff on 13 South will need to be present on other units during their phases of implementation. The spread should first happen on a couple other units and then move to a hospital-wide hourly rounding program. Leadership education on hourly rounding, education on purposeful rounding, education on why patients fall, hourly rounding task checklist, and an hourly rounding documentation form will need to be available for every unit for spreading the change to be successful. Completing my synthesis project had a huge impact on my practice. Implementing this change project impacted my practice by reducing patient falls, proving purposeful hourly rounding is successful, improving my leadership skills, improving teamwork on my unit, and increasing the safety of patients on my unit. Thank you for your time, and I hope you were able to gain insight on how to reduce patient falls in a hospital setting.